Every single month, your body speaks. But the real question is, are you listening? Some women hear the signals early, take action, and save themselves years of pain. Others ignore the signs, sometimes because they are too busy, sometimes because they think it is normal, and sometimes because nobody ever taught them what warning signs to watch out for. But the truth is simple. A woman's body never keeps silent. It only whispers before it screams. Every month, millions of women around the world experience small changes in their bodies, changes in discharge, changes in mood, unusual pain, swelling that wasn't there before, a breast lump that feels different, a period that comes too early or too late. Yet many of these changes go unnoticed or are brushed aside with statements like, "Maybe it will go away. It's probably stress. It's nothing serious." Medical experts say that over 70% of major health conditions affecting women show early warning signs, sometimes months or years before the actual problem becomes dangerous. But because women are natural caretakers taking care of children, husbands, parents, siblings, businesses, and responsibilities, they often forget to take care of the most important person in their life, themselves. And because of this, small problems grow. A tiny infection becomes a pelvic disease. A small lump becomes a tumor. A heavy period becomes severe anemia. Stress becomes depression. Swelling becomes kidney failure. High blood pressure becomes stroke. A simple sign ignored becomes a tragedy that could have been prevented. But today, I want to change that for you. Today, I want to give you 8 powerful monthly checks that every woman must do, no matter your age, your size, your marital status, or your background. These checks are simple. These checks don't require money. These checks don't require a hospital. These checks only require awareness. And the beauty is this: if you perform these checks every month, you increase your chances of catching problems early, protecting your body, and living a long, strong, beautiful life. This video may be the most important women's health content you watch this year, because it is not just information, it is prevention. And prevention is the greatest gift you can give yourself. So my dear woman, I want you to stay with me from beginning to end. Don't skip any part. Don't rush. Let this message sink into your heart. Your body is powerful, but it needs your attention. Your life is precious, but it needs your protection. And your health is your true wealth, more than money, fame, or beauty. Before we dive into the life-saving checks every woman must do each month, allow me to properly introduce myself, because who speaks to you matters, and the information you receive is only as valuable as the person giving it. My name is Nursdy, proudly representing Nursdy Elite Global Consult, a health brand built on compassion, truth, and the mission to empower women with knowledge that can protect their bodies, preserve their futures, and prolong their lives. For years, I have worked closely with women, mothers, daughters, teenagers, single ladies, married women, pregnant women, business women, women from every walk of life, and in all my experience, one thing remains constant: women are powerful. But women often ignore their own health until the body forces them to pay attention, and that is why I am here today. Not to scare you, not to worry you, but to guide you. To show you that your body is not your enemy. It is your partner. It communicates with you, protects you, warns you, and even begs you to slow. We were taught how to cook, how to clean, how to raise children, how to build careers, how to be strong, how to endure pain, how to sacrifice, but we were never taught how to maintain the body that carries all these responsibilities. And that is why I create these videos, so that women who have nobody to explain these things to them can finally have a voice they can trust, a voice that teaches with kindness, a voice that guides with wisdom, a voice that understands the female body deeply. So before we go further, I want you to do one simple thing. Commit to yourself. Commit that from today, you will pay more attention to your health. Commit that your body will no longer have to scream before you listen. Commit that you deserve to live a long, vibrant, joyful, and healthy life. Because the truth is this: and no matter how busy you are, no matter how stressed you may be, no matter how many people you're taking care of, you deserve care too. A woman who does not care for herself eventually breaks down physically, emotionally, mentally, or spiritually. And when a woman breaks down, everything around her feels the impact. That is why these monthly checks matter so much. They are small actions, but they carry big results. They help you catch problems early when they are easier to treat, easier to control, and easier to reverse. They help you take control of your health rather than waiting for emergencies. They help you understand your own body so deeply that nothing takes you by surprise. Number 1. Breast Health Exam. Your breasts are one of the most sensitive and most expressive parts of your body. They respond to hormones, stress, diet, age, pregnancy, childbirth, and even emotional changes. But beyond their beauty and importance, your breasts are also one of the first places where silent health problems can appear without warning. That is why every woman, no matter her age, must check her breasts every single month. Breast cancer does not start big. It does not announce itself with loud pain. It does not come with dramatic signs in the beginning. It starts small, quiet, hidden, like a tiny seed buried under the soil, and if you do not check regularly, it grows silently until it becomes something harder to control. But a simple 5-10 minute monthly breast exam can save your life. Many women whose cancers were detected early are alive today because they took a few moments each month to examine themselves. Use the pads of your 3 middle fingers, not the tip, not the nails, just the flat, soft part. Move your fingers in small circles. Feel your breast from the top to the bottom, from the inside to the outside, and all the way into your armpit. Why? Because breast tissue extends into the armpit where important lymph nodes live. These nodes can swell when something is wrong. Feel for hard lumps, thick areas, sensitive or painful spots, unusual fullness, areas that feel different from the rest. Nipple check. Gently squeeze the nipple. Is there discharge? Clear? Milky? Bloody? Greenish? Any of these require medical attention, especially if it happens without stimulation. Also check if the nipple has suddenly turned inward or changed shape. These signs should never be ignored. A lump, no matter how small. A spot thicker than the surrounding tissue. One breast changing shape suddenly. Skin looking pulled, puckered, or dimpled. Redness or rash on the breast. Sudden nipple changes. Discharge of any kind. Remember, finding something unusual does not mean cancer, but it means your body is asking you to check further. A monthly breast exam is not fear. It is power. It is your way of saying, my life matters. My body matters. The next one is check your menstrual cycle. Your menstrual cycle is not just your monthly period. It is one of the most powerful diagnostic tools your body has. Every month, your cycle tells you a story about your hormones, your reproductive organs, your stress levels, your metabolism, and even your emotional well-being. It is like a monthly report card from your womb, but many women do not know how to read it. Some women dread their period. Some ignore it. Some track it only for pregnancy reasons, but very few understand that the menstrual cycle is a reflection of inner balance. A healthy period is a sign that your hormones are flowing in harmony. Your ovaries are functioning. Your uterus is responding correctly, and your entire reproductive system is communicating properly. That is why every woman must pay attention to her cycle every single month. Let's break it down clearly. 1. The calendar check. At the end of each month, ask yourself, did my period come earlier? Did it come later? Did I skip it? A normal cycle is between 24 to 35 days. Anything outside that consistently can be a sign of hormonal imbalance, thyroid issues, stress, polycystic ovarian syndrome (PCOS), or even early menopause. The flow check. Observe your bleeding. Is it too heavy? Is it too light? Are there large clots? Am I bleeding longer than usual? Heavy bleeding may be linked to fibroids, hormonal imbalance, or low progesterone. Very light bleeding may indicate stress, low estrogen, or an ovulation not releasing an egg that month. Large clots bigger than a coin are red flags. Bleeding longer than 7 days is also abnormal. The color and smell check. Your period blood has different stages: bright red, deep red, or brown at the end. But if you notice grayish discharge, foul-smelling bleeding, very dark blood throughout, these can indicate infection, poor shedding of the lining, or imbalance. The pain check. Period pain is common, but severe pain is not normal. Ask yourself: do I have pain before my period, pain during my period, pain even after my period? Extreme pain can point to endometriosis, fibroids, adenomyosis, pelvic inflammatory disease (PID). These conditions affect fertility and quality of life. Pain that makes you vomit, faint, or miss work is a red flag. The body response check. Notice your body 1 week before your period. Severe mood swings, acne flare-ups, extreme cravings, swollen breasts, lower back pain, bloating. These symptoms are messages. When they become extreme, they may indicate PMS imbalance or other gynecological issues. The missed period check. If your period does not come, you could be pregnant, you could be stressed, you could have hormonal imbalance, your thyroid might be affected, your weight may be influencing your hormones. A missed period is not something to ignore. Your menstrual cycle is one of your greatest health indicators. Every month, your body hands you a message through your period. Pay attention, understand it, respect it. Check number 3. Blood pressure. Your blood pressure is one of the most important indicators of your health, yet it is one of the most ignored. Many women walk around every day smiling, working, taking care of their families, running businesses, and doing everything life demands without knowing that their blood pressure is quietly rising to dangerous levels. High blood pressure does not knock, it does not shout, it does not warn you in the beginning. And the truth is simple. Checking your blood pressure every month can save your life. Most women believe that high blood pressure only affects older people. That is not true. Today, women in their 20s, 30s, and 40s are presenting with dangerously high readings. Stress, poor sleep, hormonal changes, pregnancy complications, weight gain, unhealthy diet, sedentary lifestyle. All these things affect your blood pressure more than you know. 1. Why you must check monthly. Your blood pressure measures the force of blood pushing against the walls of your blood vessels. If the pressure is too high for too long, it begins to damage your heart, your kidneys, your eyes, and even your brain. Every time your BP stays high, tiny injuries are happening inside your body, injuries you cannot see or feel, but one day, they show themselves in the form of. But the good thing is this: all of these can be prevented when high blood pressure is caught early. 2. What is a healthy blood pressure? Normal: 120/80, elevated: 130/85, high: 140/90 or above. Many women have BP like 150/100s, 160/110s, even 180/120s, and yet they feel normal. That is why BP must be checked. You cannot guess it. How to check your BP correctly at home. If you have a digital BP machine, sit down calmly for at least 5 minutes. No talking, no rushing, no stress. Place your feet flat on the floor, put the cuff on your upper arm. At heart level, press the button and wait. Check twice for accuracy. Write down the readings. 4. Signs your BP may be rising. Most times there are no signs, but sometimes the body tries to warn you with signs your BP may be rising. Most times there are no signs, but sometimes the body tries to warn you with headaches, chest discomfort, fast heartbeat, dizziness, tiredness, nosebleeds, difficulty breathing. If you often feel these, check your BP immediately. If you often feel these, check your BP immediately. 5. What to do if it's high. Do not panic. Do not ignore. Do not wait and see. Repeat the test in an hour. If it is still high, you must see a doctor. High blood pressure is not a shame, it is a medical condition that millions of women manage successfully. Your blood pressure is your life pressure. Protect it. Check it. Control it every month. Check number 4. Vaginal health. A woman's vaginal health is one of the most important, yet most sensitive, yet most neglected areas of her entire body. Many women are taught to hide this part of themselves, to feel shy discussing it, to pretend nothing is happening down there even when something is wrong. But the truth is this: your vagina is a powerful communicator. It tells you when your body is balanced. Because infections in this area rarely start loudly. They begin subtly: a slight change in smell, a small itch, a little discomfort, a shift in discharge, a new sensation during urination, or a change during sex. What you ignore today may become a bigger problem tomorrow. But if you listen early, you protect your body from pain, damage, and complications that could affect your fertility and well-being. 1. Check the discharge. Your discharge is your vagina's monthly report. Healthy discharge is usually clear or milky, non-smelly or mildly musky, smooth in texture, not itchy, not painful. But when something changes, your body is trying to warn you. Look out for thick white discharge like cottage cheese, yellow or green discharge. Check for itching and irritation. Your vagina should not itch. It should not burn. It should not feel raw. If you notice any of these sensations, your body is telling you something is not right. It could be a yeast infection. An allergic reaction to soap, reaction to scented products, tight underwear, bacterial infection, chemical irritation, STI. Check odor changes. Every vagina has a natural scent: warm, musky, and unique to you. But when the smell becomes sharp, strong, fishy, or sour, it means the balance of good bacteria has shifted. This is something you must never ignore. Check for pain. Pain during sex, pain after sex, pain during urination, or pelvic discomfort is never normal. These may indicate inflammation, hormonal dryness, fibroids, STIs, endometriosis, pelvic inflammatory disease. PID. Pain is your body's alarm system. Please listen to it. 5. Check for bumps or sores. Any bump, blister, boil, rash, or sore needs attention. Even if it's small, even if it doesn't hurt, even if it comes and goes. Some STIs start with painless sores. Be kind to your vagina. Avoid harsh soaps, douching, tight underwear, strong perfumes, excessive antibiotics. Your vagina is self-cleaning. It needs gentleness. Your vaginal health is your gateway to reproductive health, hormone health, and emotional confidence. Checking it monthly is not shame, it is self-respect. Ladies, your health is your future. Your children need you. Your family needs you. But most importantly, you need you. If this video opened your eyes, please subscribe, like, and share it with at least 3 women you care about. You may save a life today without knowing. Stay strong. Stay safe. Stay beautiful. I am Nursty, and I'm walking this health journey with you.